Well, good morning. Thank you for being patient. My apologies for the delay. I'm Rob Bonta, California Attorney General. Appreciate your presence. And let me begin, as I always like to do, by acknowledging my incredible team, the members of my environmental and public rights team, who have gotten us to this position where we are today to make this very important announcement. We have Nick Campins, Deputy Attorney General, Tatiana Gower, Deputy Attorney General, Stephanie Lai, Deputy Attorney General, Sarah Morrison, Supervising Deputy Attorney General, Ed Ochoa, Senior Assistant Attorney General, Francesca Gesner, Chief of Policy, and Matt Rodriguez, our Chief Assistant Attorney General, who is retiring after 35 years with our office and 43 incredible years of service to the state of California. And I want to thank our state agency partners who provided invaluable assistance to our investigation, including the State Water Resources Control Board, including specifically Yvonne West, the director of its Office of Enforcement, who joins us here today, Cal EPA, and the Department of Toxic Substances Control. We are here today to talk about a campaign of deception pushed by some of the largest corporations in the world that have hurt and harmed an untold number of Americans, everyday people, children, moms, dads, people from all walks of life. We are all exposed to toxic, so-called forever chemicals, commonly referred to as PFAS. Forever chemicals are all around us, everywhere you look, in our bays, our lakes, streams and rivers, in this bay. They're in our fish, our wildlife, our soil, in our very bodies. In fact, forever chemicals are in the bloodstream of 98% of Californians. They are toxic and they are harmful to human health and the environment. Human exposure to these chemicals can occur from contaminated air, water, soil, or food. They get there by being widely used in consumer products, from food packaging to fabrics, cookware to clothing, carpets to cleaning products. And important to highlight today, on the eve of Veterans Day tomorrow, those who work or live at or near military bases, along with airports and industrial facilities and even local fire departments, are particularly likely to have been exposed to disproportionately dangerous levels of these forever chemicals. This is a public health danger for our veterans, for our service members, for their families, and for all of us. And that is why today, thanks to the incredible legal and investigatory work of the team here that I'm proud to stand with, and their colleagues, the California Department of Justice is taking on chemical giants, suing 3M and DuPont, as well as a number of smaller manufacturers of forever chemicals, for their role in pushing a widespread campaign of deception about these toxic substances that litter our bodies, poison our air, harm our wildlife, and take a toll on our frontline heroes, including our veterans. In our lawsuit today, we allege these companies knew for decades that PFAS are toxic and harmful to human health and the environment. Yet, they continued to produce them in mass and for mass use, and concealed their harms from the public, causing irreparable harm to our natural resources, to our health. For decades, manufacturers were aware of toxicity of these chemicals, persistence and prevalence in humans, but chose to deliberately mislead the government and the public. Let's go through a couple decades here. In decade one, beginning in the 1940s, 3M began to make PFAS, a popular PFAS chemical, that would later become widespread in firefighting foams used by the military and others. And these chemicals are completely man-made. They are synthetic. They do not naturally occur in the world and nature and the environment. In decade two, as early as the 1950s, 3M and DuPont began testing the impacts of these forever chemicals. Based on their internal studies, the companies knew that these chemicals were toxic to humans and the environment. That is the 1950s. Decade three, by the 1960s, the manufacturers had confirmed that these forever chemicals were leaching into groundwater and contaminating the environment. Decade four, the 1970s, they confirmed that these chemicals bioaccumulate in humans, they concentrate, and they stay within us. These chemicals do not break down. That is their main feature. Yet even after 3M ceased manufacturing these chemicals in response to pressure from the EPA, it worked to control and distort the science in the decades that followed, attempting to minimize to the public the real dangers of these chemicals. As recently as November 2018, 3M publicly stated that this is a quote, the vast body of scientific evidence does not show that PFAS or PFOA cause adverse health effects in humans at current exposure levels or even at the historically higher levels found in blood. This is simply just not true. Similarly, notwithstanding a half-century of internal knowledge of these chemicals' health and environmental risks, DuPont publicly stated in 2003 that, quote, we are confident that there are no health effects associated with exposure. This is not a human health issue. Again, not true. As a result of this deception, forever chemicals are pervasive right here in our state, in California. Data from the State Water Resources Control Board shows that these chemicals are in nearly every body of water and including what comes out of the tap for at least 16 million Californians, with especially high levels near, among other places, military facilities. The potential harms of high concentrations of these chemicals are severe and they are debilitating. PFAS can cause adverse health impacts, including developmental defects in our children. They cause cancer, including liver cancer, kidney cancer, testicular cancer, breast cancer, pancreatic cancer, and prostate cancer. They cause adverse pregnancy outcomes, infertility, reduced bone density in children, and impacts on the thyroid and immune systems. Exposure to these chemicals has also been found to limit the effectiveness of common vaccines across multiple studies, which, given the last 2.5 years, should be particularly alarming. This impacts all of us. And let's all remember that today, the day before we celebrate and thank our veterans for their service, they are more likely to face these harms. In our lawsuit today, we allege that the manufacturers knew or should have known about these dangers when they made and or sold products containing them, and that the manufacturers failed to warn about the dangers of these chemicals and, in many cases, concealed them entirely. Our lawsuit seeks multiple forms of relief: injunctive relief, damages, penalties, restitution, and abatement. This includes statewide treatment and efforts to remove PFAS from our environment, primarily through treating multiple layers of our water system, from drinking water to wastewater, to prevent these chemicals from further building up in our bodies. This also includes other funds necessary to mitigate the impacts to human health and the environment through testing, medical monitoring, public notices, replacement water, and safe disposal and destruction. We do have the technology to do these things, and the manufacturers must pay for that. The damage caused by these chemical giants is nothing short of staggering. And without drastic, aggressive action, California will be dealing with the harms of these toxic, forever chemicals for generations. That's why we're taking action. Today's lawsuit is the result of a years-long investigation that found that the manufacturers of PFAS knowingly violated state consumer protection and environmental laws. We won't let them get off the hook for the pernicious damage done to our state, to our children, to our people, to the health of Californians, and certainly also to our veterans. if corporations break the law, if they try to cover it up, they are going to face the full weight and the full authority of my office. We will hold these companies responsible for their dangerous conduct. That's what we are doing today. Thank you. I'm now also available for any questions that you might have.